got into this work kind of by chance. I was the president of the Louisiana School Counselor Association, and the governor of our state requested that someone fill a position on the advisory board for the prevention of human trafficking and social justice. And so I was really excited to have an opportunity to participate in that. And that was over 3 years ago. So since then, I've still feel over the 3 years that I know this much about human trafficking, and I've done a lot of work and a lot of research. And so I'm learning daily with each conversation I have. So I guess the hope that we have from today is that moving forward at the end of our presentation, that we can have some discussion with the folks that are in attendance today. And I see Rebecca, thank you so much for getting that up. That's appreciated. Good. Okay. So Laura and I had put in for a grant from the Louisiana Children's Trust Fund, and luckily and gratefully we received it, and it was fully funded last year in November. So we were able to provide a free conference for 200 participants in our community and offer continuing education units. And we invited a national speaker, Mary Vicario from Ohio, down to be our presenter. And she's done over a decade of work in this area. And so the actual interventions that I will share later on are from her. And she has also given me permission to give you guys her contact information in the event you would like to reach out to her. She does trainings all over the country, in fact, and has a lot of work with them as well. So that's sort of our introduction and why we're here and how we're excited about the topic and how it's such a major, important piece that all educators and counselors in particular need to be aware of. Us here in Louisiana, we have a large number of human trafficking survivors, and so I'm also like to hear from you guys at the end if possible. So I will turn it over right away to our first graduate student presenting, Ms. Rebecca.
All right, good morning, everyone. So we'll start out with, going over what a traumatic event is, because most definitely these young women and men have experienced trauma just by being trafficked. But what makes it, more specific is that a lot of it is compounded. But, traumatic event, as most of us have clients that have experienced physical or sexual abuse. It can involve around physical, psychological, even neglect, and definitely human trafficking is almost all of them because it violates their threat to their body and integrity. So just that one definition of a traumatic event, it's like they almost have it defined with all the experiences they have with it. It's a distressing event that they feel threatened, anxious, or frightened as a result from a traumatic event in general. And that can, it's more specific with compound trauma, complex trauma, because it compounds. So whenever they're trafficked, they might experience the neglect, not knowing where they're going to get their food from, invasiveness of their privacy. So it's just one thing after the other, along with all the exploitation. And so that kind of flowed into what it is. And it is a forced coercion to obtain some type of labor. And a lot of times it is a commercial sex act, which definitely violates their human rights of, freedom, integrity, the rights, all of their rights are just gone. And some people might think, oh, this doesn't happen in my backyard. Oh, this doesn't happen in our neighborhood. We live in somewhere really nice. But surprisingly, it's everywhere. Huge football games, the Kentucky Derby, Hammond, Louisiana, where we're from. I mean, it's all over. And I think it's important for us to not think of it as, oh, it's just an international problem of it happens in different countries, but it happens everywhere. And so the traffickers use a lot of violence, manipulation, and false promises of well-paying jobs. Like, oh, look at these models. I want to be like them. And they can find vulnerable populations that say, hey, if you come model with me, you'll be taken care of. You'll be a secure job and you'll be able to give money back to your family. But then when they find out, they end up being trafficked. And even romantic relationships, someone might find them a vulnerable state and realize that this person, they could exploit them. So it could be a healthy couple, or it may look healthy, but someone in the back is really exploiting them for, you know, sexual purposes, or even labor as well. And so kind of tying it back with the trauma, all of that being said, it's a compounding of emotional, physical, and psychological abuse over years or months, or even the shortest amount of time. It's still a very cruel and intimidating environment that they're in. And I think as counselors, we should be aware of all of their experiences. You know, this is a very specific type of trauma. We can't just go in with, oh, sexual abuse and just kind of think of it like that. Well, some of these men and women, or even young girls and young boys, had to experience being forced to use drugs, or being forced to go months, or I mean weeks, without food, or whenever, not knowing what their security is. So definitely understanding the complexity of human trafficking, I think, is a goal. And using our basic counselor skills of, let's validate them, let's listen, let's be present for them, and give them control in that session as much as possible, because they haven't had control in a very long time. You know, some excuse me, the sex traffickers control every aspect of their life. So it could be monitoring their daily functions, their actions, inflicting fear of, hey, if you tell anyone, I'm going to hurt your family, or if you report me, I'm going to hurt someone you love, or, you know, you can go deeper than that. So the trafficker's main goal is about control, and the victims are left without it. And so through the control, they can exploit these individuals even further. And so because their control is kind of gone, or it's very, very shattered, expressive arts is a very effective way to give that back to them. I have a lot of clients that are sexually assaulted or have been raped, and expressive arts for them is a great way to literally express their experience without feeling intimidated, or even feeling shame over their experience that they had. With expressive art, the self-regulation skills, the counselor and client can work together. It's like, all right, I feel so many emotions, you know, I don't know where to begin. And so if we can draw it, if we can make a collage over it, if we can mold it out of clay, anything to get them to physically see their emotions, I can help them process. And having it done non-verbally also takes away the I guess, like, again, the intimidation, because you can do it non-verbally in a safe environment. And a great thing about expressive arts, we're giving them their control back. You know, we're not telling them what to draw, we're not telling them what to do. It's like, here, you're not sure how to express your emotions, there you go. You know, and I think over time they can finally regain that back. You can give them that to feel empowered. And I think that's probably the greatest gift, is giving them a tool that is very safe to get all of that back. You know, and freedom of emotional expression, and freedom of verbalizing what they are feeling. If they were captive or trafficked for a long time, they couldn't express themselves genuinely. They couldn't give themselves the freedom to say, hey, I don't want to do this anymore. Or if they did, there was a lot of consequences. And expressive arts within all that can enhance their resilience. One of the studies that we have, I'm not sure how to pronounce their names. I think it's Comotri and Farmer, they had a lot of studies to back up saying, hey, after using expressive arts, it can enhance their, reduce their symptoms of post-traumatic stress, anger, anxiety, and depression. And, with all that, if we can alleviate some of that, it can enhance their recovery and even instill resilience that they can possibly overcome their traumatic events. And I think that is my last slide, and I will hand it over to Dalina.
Okay, hello everyone. So kind of going off what Rebecca said, excuse me, this was awkward, the light went off. Sorry, there's like a sign. I have to make sure I keep walking so the light goes back on. But kind of going off what Rebecca said, like why we should use expressive art techniques for human traffic survivors. It can help promote self-confidence. Like while human traffic clients like share their experience and reactions, like it strengthens their sense of identity and worth. So expressive arts are like holistic and patient-centered approaches. It's like facilitated through art therapy. Clients can not only kind of control in terms of like their steps, how fast they progress, but also the counselor can have them guide them through the art by telling them kind of like guidelines. And this expressive arts can help establish connections with others. For example, I had a client who was sex trafficked, who had a traumatic experience with it, and she felt like lost, and she felt like very low self-esteem. She felt like isolation was her way out of everything, and she came into my office and wanted to reconnect with herself and wanted to reconnect with others. And so I asked her kindly to like draw something that like she associated with the event. And while she drew like a picture, she mentioned out loud 3 things that she would want out of the experience. And she wanted to be stronger. She wanted to be like that warrior and like a hero in herself, that she had overcome that experience, and like wanting to be open to be able to talk to others about it. And therefore it strengthened her self-confidence, and she was able to go out after a couple of sessions to like reconnect with her social peers and like talk about like her experience and not being afraid of getting judged. So kind of that went back into her feeling very empowered and strong about herself. So I found that very powerful.
Oh, next slide.
So another reason why we should use expressive arts, done some research, and Lee just brought out a brand new study in 2019 that talked about that expressive art promoted like a therapeutic relationship in terms of like guiding the client in recovery for the traumatic experience. And so kind of going back to what I just listed as the example, my client that I was seeing, she was obviously experiencing a lot of fear of rejection. She wanted to feel empowered again, and she was afraid that people would just judge her and not taking her serious. So by doing expressive arts, I was able to like connect with the client on a totally different level than just doing talk therapy. And that was very powerful because the client, I could see like her presence like shifted completely. And while she was coloring her in her activity, she was talking, she was opening up way more and promoted her identity back. She found her self-worth and like hope into the future, that when something like that happens again, she feels a lot stronger about it. A study done by Litam, I hope I pronounced that right, in 2017 published that expressive arts are very powerful because not only does it offer clients to make choices, well, it gives clients that sense of control, like Rebecca mentioned earlier, a lot of human trafficking clients, they don't have that control, and like kind of giving back that control to them is very powerful, because you want to have like going out of that experience, like not thinking only negative, but you want to be strengthened and more positive into going into the future. And so therefore it's very crucial to incorporate expressive arts, because the creativity allows not only for flexibility, but also it enables them to pro-social behavior. Like I talked about in my example with my client that I had, she was able to go out and about in the world again and like talk about her experience and be socially active again with her peers, and finding that self again in her life, that she had overcome and processed her experience through like a simple thing like expressive arts. Okay. Expressive arts can also help reframe ideas, shift perspective, and externalize emotion to deliver a better understanding. To give you an example of that, I seen a client who worked in a centre, worked with me in a centre expressive art activity, and she had experienced a traumatic event, and I asked her kindly to put her own world like in like the centre. So she picked her own figures, kind of giving her back that control we just talked about, and kind of like to talk about like what is happening in her world that she created. And so I asked her to kind of go back into like that traumatic experience that she had, and she was able to like see it from a totally different perspective while creating her own world. And she was able to shift from all the negative associations that she had with the event into something that she took out of it, like positivity in terms of, okay, when this happens again next time, I'm going to be a lot stronger human being. And Litam in 2017 published that it helps to openness in a client while still providing the concepts, providing sense of structure in therapy. So again, my part was to kind of help them, guide them through, and like asking questions about what their world looks like, but I gave them the control that they feel empowered in like telling me about their own experience, and I found that to be very powerful. Okay, last slide I think for me as well. And expressive arts can help raise bodily awareness and advocacy in clients who struggle with like just talk therapy. And again, in all my clients that I have applied expressive arts with that have been experienced traumatic events or have been sex trafficked, talk therapy is not only, it's not enough. Like I have experienced that through expressive arts, like the therapeutic relationship, it clicked right away, and it fostered so many more emotions in clients while they were able to talk about the event. They were kind of distracted while putting their figures in a sand tray or coloring a mandala or coloring just anything that came to their mind associated with the event. And just fostering that with like talk therapy and connecting the expressive arts is in my opinion, is a very powerful source. So for the client to be able to talk about it and to have like that verbally expression by just not having a conversation about being like doing something else with like their hands, like or like Play-Doh or anything like that. And it is very important that then the mind kind of connects with the body. And I had a client who that was playing with the sand tray, and while she was putting her traumatic event in the sand tray, like she was like telling me how everything kind of was, and she had never really noticed that her heart was racing. So it is very kind of interesting to see how like when you just talk about it, you don't notice those things, but while she was like actively doing it and reliving her traumatic event, she was kind of listening to her body and listening to her heart and like what she was hearing, and like kind of like having all the senses present. And I found this very interesting to observe. And so therefore expressive arts are not only something you can apply to children, but also to adults so that they can externalize their experience to all their sensory means.
Yeah, and I just want to, before Dalina moves forward, just kind of address the advocacy piece a little bit. I think we had a question about that. Just 2 points. One point I wanted to make is, you know, when we work with clients who have been survivors of human trafficking or victims, I think it's important to understand as clinicians that, you know, our goal going into the session is not necessarily to have them recreate that trauma. I think that's up to the client when they get, when they become comfortable in the session. If they want to do that, they certainly can, but they don't have to do that to be able to move through and to be able to have some interventions like the expressive arts techniques that will help them. So it's just not necessarily about recreating that trauma using the expressive arts. It's using the expressive arts to help them to get the power back. And that's why I wanted to talk about the advocacy. I think it's important when you have clients who have been marginalized or who've had power taken away from them in every aspect, that you work with them to help them become self-advocates. And a way to do that, and I'm going to talk about this when we end the presentation, is to give them the power back, in that session. Expressive art techniques are a great way to do that. You allow the client to create how they perceive what's happening to them or what's happened to them. There might be some struggles going on in the family system. They might be having some other struggles, and it's their way of kind of conceptualizing that and giving you a look into how they perceive what had happened to them, and then working with them to give them that power back and hopefully helping them learn how to gain some self-advocacy skills to be able to advocate for self in other situations, so that they're not put back in that situation to be a victim again. So that's kind of how the role of advocacy comes in when we work with these clients. And remember, that's down the road. This is a long process for these clients. So helping them do some of that, you know, is not going to happen in session 1, 2, 3. It's going to be, you know, down the road, working with them, you know, over a longer period of time.
Thank you.
Sure.
Okay. So I think before we get started on these actual interventions, just to clarify, I saw in the chat box there were some questions about, you know, just kind of in general, what are expressive arts, you know, and what does that look like? And so this wasn't meant to necessarily be a presentation on that, but it does make sense that perhaps some folks are not as familiar with that topic. So I'll stop for a second and just sort of fill in some of those gaps. I mentioned earlier when we first started that we offered a workshop in November of last year with presenter Mary Vicario, who came down, and what we did was we adopted a local human trafficking safe house. And Metanoia Manor is located in Zachary, Louisiana, and it houses girls, both children, adolescents, and adults, and their children, if they have them, as a way for them to sort of get back into society and get everything they need, from their medical care to mental health services. In fact, we have one of our current interns in the counseling program working at Metanoia Manor with those girls now, and it has been a wonderful experience. But when we adopted their agency and asked them what they would need from us as the workshop, in lieu of a registration cost, we asked that they donate an expressive arts item. And so a lot of times, you know, what you mentioned in the chat box is, well, what is that? And so we had to actually clarify to a lot of folks as well. So I think that's a great question. And when I called Metanoia Manor, the director, and I said, what do you guys need the most of? You know, we can assume, but, you know, the results were kind of amazing. And so, yes, it varied from crayons and Play-Doh and markers and construction paper and things of that nature, but also all the way down to sewing items. And so a big part of what they do is they teach the girls how to make things that they can not only sell and hopefully gain some cost to help them recoup in society in the future, but also as a way to give back to the community, as a way to have a sense of purpose for moving forward. And so it's a sense of responsibility. So anything from, Rebecca, I believe, is looking for a photo right now to show you guys on the screen all of the items that we collected and donated. But, you know, they had journals. We also had inspiring quotes. We had paint by number. We had, of course, all of the different adult coloring books, children's coloring books. We had mandalas. We had sensory items, so safe sensory items. So certainly we didn't have anything that would potentially inflict harm, but we had things that were safe, such as felt. Any sort of type of fabric or different item that can access all of the different senses can be very helpful in grounding skills with your clients. And so, you know, we know with trauma survivors, helping them to ground themselves and to remain in control of their body and their emotions is an important piece of what we do with them in a therapeutic process. You know, talking about even the word body is sometimes a trigger word for a lot of survivors of trafficking. And so we need to be sure that the language we use is appropriate. But a lot of the other items we had were felt, sandpaper. We had soft, furry, you know, sort of fabrics. We also had things that you can smell. So a lot of safe oils. You know, I think she's going to access it now. You'll be able to see a little bit more paint and poster board. And we also had, they like to make pillows as well. So we had a lot of cotton for stuffing. And so as you can see, it's really anything that, and hey, thanks Rebecca, good job. So we are really excited to donate all of those items to them. So pretty much if you can go to, or in your mind, Michael's craft store or somewhere like that, and you can go down pretty much any aisle, and that's what an expressive arts item is and can be for them. Again, the things to remember, yes, they were all donated. We were so excited. The grant we received that was fully funded, as mentioned earlier, instead of lieu of registration costs, we had them to bring one item for donation to them. And so that's all of the things that we were able to give them. And part of their community activities during the day, they have a schedule certainly at the Human Trafficking Safe House. And part of their day, built into their day rather, is times to do these sort of crafting activities. And so when we think about expressive arts activities with trauma survivors, we don't necessarily need to, you know, create, you know, this huge project, or we have to have this certain script. It's just a way for them to sort of have control over their body, over their emotions, and to be able to access what's going on within them as they're doing their expressive arts activities. You know, a big piece of what we know in the human trafficking literature is that cognitive reframing and structuring is a big piece of what we do. And so it's really, really important, as you know, working with any trauma survivor. Human trafficking is different. It's not the same. It shouldn't be treated the same. It's a very complex topic. And, you know, what's really exciting is that, you know, sort of people in the advocacy board and in conversations that we're having, this movement seems, oh, hi, Crystal with Metanoia. Yes, glad you're here. All the items went in her car to go back to the house. And so, Crystal, maybe you can actually jump in a little bit. We'd love to be able to hear from you and how the girls have actually used these items and how they've been effective, or if you have any suggestions of things to the participants that are joining us today that might be more effective. We'd love to hear that in a second as well. But what we do know is that this movement with learning about human trafficking is sort of like the domestic violence movement 20 plus years ago, right? We're really just at the ground with understanding as a profession in mental health, you know, how do we do this work? What does it look like? What is evidence-based practice? How do we know that? Is it appropriate to, you know, do research with survivors, you know, when they're just coming out of captivity, for example, or when they're in the middle process of, you know, their journey of growth and healing? You know, where does that research work best, and where is it most effective for the girls? So I think there's so much work that we can do as a profession in learning and understanding what this, you know, phenomenon is that we're dealing with in our profession, and understanding that we have a really long way to go. So these are just some examples back to what expressive arts items can be, what they look like. Certainly Dr. Laura probably could talk a whole bunch about that. That's her specialty, play therapy. and how play therapy is not just effective, obviously, for children, but very effective for adults as well. With modification, we have to pay attention to not only their chronological age, but also their developmental stage and where they are, and be appreciative of that. I think some questions that were mentioned is, what is the difference between art therapy? Well, certainly we don't ever say we're doing play therapy or that we're doing art therapy unless we have those specific credentials. And so, we might be utilizing art-based activities. We might be utilizing play therapy interventions as a modality in working with our clients. But just to be clear that I'm not a play therapist, and so I would never say I'm doing play therapy or art therapy, rather using these modes as a way to work with our clients in expressive techniques to help them to sort of work through what they're working on. I'm going to check the chat box for just a second. I see some things coming up. Also, and thinking about where our clients are with respect to coming out of a sex trafficking or human trafficking incident. A lot of times they just need to work on social skills. They need to learn how to be a human again. They need to find what feels safe. They need to understand oftentimes that healthy looks a lot different to them than maybe they've been taught. Also, it depends on how long the person has been in this situation, and we're referencing girls in the girls' house we're speaking of, but we certainly know that boys are also victims and survivors, and the LGBT community is a big risk population as well, and transgendered youth, and we have lots of statistics to show that. But thinking about the person and do they even need to understand how to have a conversation? Do they know how to wash clothes? Do they know how to have privacy? Do they know what's appropriate in communication when someone's talking to stop? So a lot of times, basic needs need to be addressed from the very beginning, and expressive arts is a way to do that, right? So we can just even, have a conversation about who's going to pick out the expressive arts item, right? I think a question that someone posed was, is it okay to be silent? Is it okay to work alongside of them, right? And so Dr. Laura mentioned, it absolutely depends on the client. And a way to do that is to sort of model for them how that's done sometimes. And so we can give them some options. If we had this big table in front of them, that might seem pretty intimidating, right, to a client. So we might have to have some parameters and boundaries. Certainly that's a big piece of the work we do with these folks in particular, is teaching them how to have healthy boundaries. And so sometimes setting some parameters around, we have maybe 5 items that we're going to look at today. And does anything look interesting for you to work with? And so sometimes just asking them, giving them some direction and purpose, giving them a voice, and helping them to understand that we can work through some of these basic things we just talked about, just through the use of a non-threatening manner, and that is through the expressive arts. Someone's posing, what's the average age of trafficking victims? And I think that depends across the world. You'll see lots of different numbers, but certainly we know that if it's someone being born into the trade, then it can be as early as infancy. And then also, adolescence is a huge, or pre-adolescence rather, is a huge time where, people can be groomed for the trade. And that looks a whole lot different, in different parts of the world. As we mentioned, I think a lot of people think that this is, a third world sort of problem. And what we know, in fact, that it's completely the opposite. It's, someone on the next street of you. In fact, it's not just rural areas, it's not just inner city. Here in New Orleans, we're a very vulnerable population for trafficking because we have many different, many different reasons. We have the biggest port, one of the biggest ports in the world, where a lot of trade is done. We also have tons of, social events and big sporting events that people come into, Jazz Fest, Mardi Gras, things of that nature. But then we also have intersections in the interstate where we have the Florida parishes, for example, where there's, a big part of where we know that trades happen. And so there's a lot of statistics. You can actually go, if you're interested in these numbers. Part of the work we did on the advisory board for the governor, and we put together a report last year, and that is through the Louisiana Governors Association. website. I believe I can post that to whoever's interested. They can email me. And there's an actual report with some recommendations on how we can address this, you know, at all levels, pre-service, intervention levels, and so forth and so on. But we do know that it's all ages, to clarify that question. There's risk factors to be aware of, and this starts very, very early. If you're looking at the systemic sort of issue, you think about how school counselors can play a part in this, how clinical mental health counselors, how marriage, couple, and family counselors, how those in the foster care system, how those in juvenile justice and in diversion programs for adults. Everyone has a part in this concern, and all of those people can use expressive arts items at different levels of where we're getting the folks out of the trade. I'm going to maybe pause for a second and just look up. I see that there were some questions here. Dr. Laura, did you want to jump in at all with expressive arts? Look at these questions.
I can. I just wanted to mention too, you know, there are a couple other things that you can use that I consider to be expressive arts. I think music is a big one. I think, you know, working with this population, one of the things that you can do is have them, you know, talk with them about maybe who their favorite artist is, how do they identify with that person, what characteristics does that artist have that might be resilient, as in the same with some characteristics they might have that might show some resiliency. Also asking them to maybe bring in their favorite song or choose a song that describes kind of where they are now, and then as you move through the therapeutic process with them, you know, you can continue with having them select a different song that describes where they are throughout the therapeutic process. So I think music can be very powerful. And then the other thing that I consider to be expressive too is the sand tray, and we could do a whole workshop on the sand tray, but I think that when you work with clients who have had any kind of trauma, the sand tray is very effective, especially clients with complex trauma. It's very powerful. Sometimes it's very hard for clients, especially human trafficking survivors, to be able to sit and talk about what has happened to them, or even to talk about anything, you know, even because some of them don't even have basic social skills to be able to do that. So I think the sand tray can be very powerful. Just having them create something in the sand, or create a story in the sand that they would like to tell you, or create maybe how they're feeling, you know, about maybe where they are, if they're living in a residential facility, or if they're at a place like Metanoia Manor, how are they feeling, you know, about being there? Just having them create that in the sand, and then you give them the power to tell their story, you know, through the sand, and to focus on what they would like to, you know, and tell what they would like to. So I think that that's very powerful, you know, as well. So those were just the two that I also wanted to mention, you know, in terms of expressive arts. And there's a lot of other things you can do. There's a lot of other specific activities, you know, like collaging and different things, but that's kind of a whole nother workshop.
Yes, and so, you know, part of the reason that we don't just give this manual out is so that people understand that this work, again, it needs to look different than just working with trauma survivors. And so training is really important. And so that's why I mentioned that, and Rebecca, you can, if you can, pull up the actual exercises that are shown on the screen when you can, that'd be great as I'm talking. They were emailed to you, sorry. So, you know, and thinking about how is it different, right? So something we have in our state as well is a Human Trafficking 101 that's free, and anyone in this presentation today, if you're interested, please email me, I can forward that to you. It was created by our Child Welfare Academy through the social work program with Dr. Corey Hebert at Southeastern Louisiana University. And it is a human trafficking training with an actual survivor. And I think that's also important too, in all of these trainings, to have someone who's, you know, survived and can give some really great feedback. I'll definitely give my email in the chat box in a sec, Jessica. But helping law enforcement to be trained, and, you know, nurses and medical physicians, where we know we find these, you know, survivors oftentimes are the places like urgent cares or dental offices or emergency rooms, abortion clinics, you know, massage parlors obviously are a big part of that as well. But having, places in your community that have the education, and that's something that, when I mentioned earlier, how we have a long way to go in our profession is, it's not just something that we can expect to just show up in our office for traditional therapy, right? These are not the clients you're going to have. So making sure that you're building partnerships with places in the community, making sure that there's, you're aware of the referral system in your state and how they can be identified and where they can go for safety and so forth and so on is really, really, really important. So, keep in mind that this is not just, a presentation to say, these are some great fun things you can do with your clients. In fact, it's completely the opposite. You have to really have some education on the different ways to work with the survivors. And so these activities are, it's a part of a manual and a training protocol that they have in Ohio that Mary Vicario does. And so before you, attempt to do any of these activities, please get permission, from her first of all, but second, have some training, let this be maybe a part of your excitement that you move forward to learn more about this topic. And I will certainly email everyone who wants it later as well.
But I just want to say that's one of the reasons why Dr. Marino and I wrote the grant that we did, because we found as we were talking to clinicians and in our work that so many folks have not been trained to work with human trafficking survivors, and it's just, it's different. So we felt like we need to help train clinicians. And that's one of the reasons why we wrote the grant and we brought Mary in, and we were able to train, 200 folks who are now going to go out there and do some of this work.
Yes, absolutely. So if you look at the safety script, this felt safety process, these are some activities, and I'll just briefly go over them again, just for sake of time. I'd like to hear from Crystal, who actually is the clinical director over at Metanoia Manor, and give some time for questions as well, if anyone else has them. But thinking about the felt safety process is the safety script should come first, right? And so an example of this, and Rebecca, don't worry about grabbing it if you can't find it, it's fine. So the template would sound something like this. This is a safe something, whether it's a place, a family member, or a space, a room, whatever that may be. So this is a safe blank. It is important that no one blank, and that would be the behavior that you want the person to stop, right? So it is important that you not something, again, the behavior, and because this is a safe, again, the first blank. So it would sound something like, this is a safe family. It is important that no one hit you. So it is important that you not hit anyone because this is a safe family, right? So a safety script is really important from the very beginning to help them to understand that there is a problem behavior that they're trying to most likely work on. Again, this is the work that's in the human trafficking literature that's most effective is working with neurological education as a clinician. So you have to understand that this is a brain process. We have to help rewire these survivors. And oftentimes it's by the very, very basic things, such as the safety script, that is very important for them. Because again, they haven't been safe, most likely. And again, there's the whole background on what trafficking is and how they stay trapped and how they, sometimes don't see it even as a problem. Is a whole nother presentation that I encourage you to get some more training on. And all of you that are posting your emails, if you can email me, because this Zoom will go away after, I believe, and so I won't have the chat box, but my email was in the chat and you can just email me directly and I can forward you the information. So the safety script would come first, and then the roots and wings activity is an example of a tree. If you can picture a tree and there's the leaves on the top and the roots on the bottom. And this is where you help the client identify things that can help them up-regulate and down-regulate. And so up-regulate would be an example of things that give them energy and joy. This can be people or other things. And also the down-regulate, the roots would be activities or people or things that help ground them, help them feel soothed, help them be calm. And so it's really important, again, that they sort of figure out what helps them regulate emotionally. So DBT is a really effective intervention in working with these clients as well. Again, must have some training in order to do that. Using the body mandala, certainly we probably all have some general knowledge of what a mandala is and how it's effective with clients, and it can be utilized with many different issues and helpful with many different clients as well. But this body mandala sheet is more of an expressive arts intervention that helps them to sort of paint a picture of what they're feeling when they're feeling it in their body, right? So a lot of times clients might not know why they're feeling something or what they're feeling, but they can put a color to it. They can sometimes put a sound to it. They sometimes can identify in their body where it's happening. And so this body mandala is a part of that expressive arts intervention where we help them to see when they're feeling emotions, and we help them name it. And so we help them, decide how they can give it a size or a shape or a color. And what we do know from the work of Dan Siegel and a lot of the trauma work and interventions that he suggests, yes, I definitely will repost my email, is that sometimes clients don't know why they name or color things the way they do, but there is a meaning for that. And so before clients can get actual language to speak to their experience, that could take a long time. But if we can help them to figure out what's going on, when it's going on in their body, we can help them to rewire things, right? Next would be the anger volcano. Obviously, if you can think about what that might look like, there's a great representation on how the brain can be reworked and sort of have different synapses to be help them to not get to the top of that volcano and overflow and pour down, and that they can actually cut across the volcano. And so part of this activity helps them to sort of stop as they're rising up and cut over so that they don't have to go around and go back on the bottom of the volcano when they explode. Also, we help them to think about the 3 Ps: predict, practice, and plan, right? So this is an execute action. This is how they can actually walk through a situation that is new or might, create some sort of anxiety or stress for them. So we want them to predict, what do they think is going to happen? They want to prepare for this, right? So they might be going to meet someone for the first time, and they don't know if they can trust them or what does trust even mean. So we want to help them predict, what do you think would happen? What would you like to happen? What do you worry about happening in this situation? So that would be the first P, predict. And then we want to practice. We want to talk about, we don't want to just talk through it. We want to create a body memory for them. So sometimes role modeling, actually getting up and acting out the situation would be very helpful for them. Because what we do know is that in fight or flight situations, we do remember things that we practice in those times. And so we want to help them to practice. And then we want to have a plan B, a backup plan. What if it doesn't go the way you plan it? Are you going to erupt like the volcano, or are we going to have a plan B? Right? So what else could you do to help your body regulate, to help your emotions regulate? Let's go back to that tree activity and let's think about those roots, how you down regulate, how you up regulate. So we have to teach all of these skills sort of in a fashion as they build skills, and we want to incorporate them all together. Certainly the reflect, honor, and connect is something that helps survivors be heard in general. And it's not just that it feels good to be heard, but it really helps them to see that we hear them. We understand their pain that they're going through as they're talking to us, as they're expressing themselves through arts or play therapy interventions or art therapy interventions, but also that it helps our brains to release dopamine. And, that's a whole nother presentation about actually the neurological implications and how the brain plays a big piece in what we do with these clients. But again, that's a whole nother presentation. But actually honoring them and connecting with them helps them to release dopamine, which makes them feel better. It's that power of connection that they can learn to trust again. They can learn to feel safe again. And that's a beautiful piece of what we do with these clients in general. So that's sort of a very brief overview of the felt safety process that I definitely encourage you to get some more training on at a deeper level. I'm happy to share that information, and I know Mary would be as well, but it's 10:51, and I really would like to hear from Crystal, if I can. What can you add to what was already discussed, and just kind of want to leave it.
Can you hear me?
Yes.
Okay, so I had to switch over to my phone. I don't have a camera on my work computer. I want to start by just saying again, thank you, thank you, thank you. When I saw that picture again, it just made me emotional all over again. Our girls were so excited. When I pulled up at Metanoia, they came running out to help. Miss Crystal, is all of that for us? Like, they just couldn't believe it. We are going through it. I mean, we're almost out of our campuses now. They love to paint. And I have this long wall on the way to my, down my hallway to get to my office that just never had anything on it. And I can't take all the credit. This was really Gina's idea, but to turn it into an art wall. So we have been putting up all of their art that they do on this wall. And I just leave my door open a lot just so I can look at it and smile. It's so pretty. The sensory, I love that you brought up the sensory with the grounding. They love it. Any kind of sensory input we do. They actually do like a lot of talk therapy, believe it or not. We do a lot of play therapy too. They love the sand tray. But when they want to talk, they'll just go through my bins and they'll grab Play-Doh. And they're just playing with the Play-Doh the whole time, just for that sensory input. It does calm them and ground them. I love how you said just be a human again. That's a lot of what we're working on here. And I love that they have this safe, controlled environment for them to do that, to be able just to work on them, find out who they are again. They come to me and they'll say, I'm just so broken. And I'm like, but you're not Humpty Dumpty. You can be put back together again, and it's so wonderful and affirming seeing them put these pieces of themselves back together. And when something just clicks with them and they come to me so excited about it, they'll write me a note, Miss Crystal, look at this. I was able to actually apply this time. Or when they can do their coping skills on their own, when they get triggered. It's just, I don't know. I just love it. I get goosebumps when I talk about them. I don't know. I'm not really sure what else to say except just
that's
thank
wonderful.
you.
Yeah, thank you for being willing to share, and it's great to hear that it's working, and that's helping them. And also, I think something that was so powerful for me as a clinical coordinator when I had to go and visit the site and make sure it was going to be a suitable environment and safe for our interns to go to. I was just blown away. It's a beautiful space. It's serene, and so I think too something that we need to remember with utilizing expressive arts items is a safe place for them. And so if they can create that first, right? So something I always like to do is with survivors of any type of trauma, but help them to create a safe scene. And so that can be modified in many, many, many different ways. But a very overview example of that is you help them to, it can be done on paper or, it can be done on poster board or whatever, but it's for them to create a space for them that they can call safe. And so that means what do you see? What do you feel? What do you hear? What do you taste? What do you smell? And so you have to access all of the senses and you get them to incorporate that into their safe scene. And so that way, anytime you begin processing any type of event, you help them to recreate the safe scene. And so I sort of let them, it's like a Polaroid picture where you can, sort of develop it over time. So it takes practice. And then you sort of use it as a guided imagery type of activity. Where you help them to really place themselves in the safe scene. A lot of times clients will put other people in their safe scene with them, and we want to encourage them not to do that. We want them to be in their scene by themselves safe so that they can actually feel that first. And then you can get them to put that anywhere, in their room or in the therapy room, wherever you're working with, to help them to see it and feel it and know it. When I went to go visit the site, I thought the most beautiful thing was there was actually a girl there, a survivor, and she has a baby, and so the baby lives there as well. And the clinician at the time was sitting on the floor with her, listening to music, and that was their therapy session. And so when we think about what does expressive arts interventions look like, as Dr. mentioned, music is a big piece of that sometimes. How do we show our clients how to be a mom? How do we get them to connect with their child? How do we get them to teach developmentally appropriate skills for their babies? That they have never likely been taught before. And so that's a big piece I thought was such a wonderful thing to see as well, is to incorporate that music piece. And it was very powerful. And so that, I don't know if that person's still living there, but hopefully the baby's still jamming along because great old time doing that. But the safe scene again, and just some things to remember is that we have to be careful when we ever tell survivors to close their eyes. We want them to feel safe first. We want to keep a distance. We want to keep reminding them, where they are, what time of day it is, what day it is, why it's a safe place to be with you.
Right.
Because we can't do any work with them until they have that sense of safety first. That's the first and foremost thing that you can do. And you can do that with any expressive arts item that we showed you in that picture, and how they can develop a sense of safety. That might take some time, as we mentioned. But that hopefully is helpful to all. Rebecca, Dalina, Dr. Laura, anyone else want to add anything before we maybe turn it off to the final question?
I just wanted to just let them look at, I'm not going to go over all this, but these are just some final thoughts in terms of what we talked about today, and just some things that you can kind of take with you in terms of, expressive arts. Being able to assist folks with the therapeutic connection allows the survivor to tell their story, that giving them the power back is very important, helping them transfer these techniques to their lives outside of session, and also looking at some bibliotherapy, to use. And also what Dr. Marino was saying about the safe space, you can also use the sand tray to help them create that safe space. That's a really good way to help survivors create that space, in the sand where they can feel safe.
I have one more thing I want to say before we go. Gina told me I could throw this out there. So we are in the process right now. We are looking for someone who can provide, this is kind of our dream, to provide in-house, like I do, I'm in-house every day, but to be able to bring in an addiction counselor for eating disorders, substance abuse, all sex addiction, and also an in-house psychologist or psychiatrist, someone who can do ongoing assessments and monitoring with them, because we noticed that when we take them away from metanoia to an outside psychologist or whoever, we're not getting accurate results with them because they don't feel safe. They can't develop a rapport with them when they see them once a month for, it's not even an hour that they're really in there. And it just hasn't been very beneficial or successful. So just, if anybody knows, I just want to put that out there so kind of word can get around that we would love to be able to provide that extra service for them.
Yes, thank you, Crystal. And if you want to add your email in the chat, people can maybe contact you, and then also contact me as well. But yeah, I think that goes back to what we were talking about before, that, the actual practice of doing things is really important. And so if we don't, practice those things with the girls before they go on their doctor's appointments or their interviews or wherever they're going, oftentimes people aren't getting an accurate picture of what's going on, because they can sort of then just put on, at that time, because they're so used to putting on a face,
yes,
an emotion or numbing or whatever. And so I think that's wonderful. I do have some suggestions that I can send to you after as well. And then do you have time integrating survivors back into society? I think that's absolutely dependent on the person, and again, how long they've been in the industry. Is it multiple traumas? Is it one time? How old were they when they got into? I think there's so many factors to answer that question accurately. But I would say that yes, they have a very difficult time acclimating back into society for many of the different reasons we talked about. As we know, with change is difficult. It takes consistency and a lot of time sometimes to be able to reteach these skills and rewire the brain, what we're talking about. And so when we think about, remediating them and giving them these skills and interventions, and then they go back into society, what we know about change and homeostasis and systemic issues is that we sometimes go back to what we know and what's comfortable. And so yes, there's a big piece of, transitioning back and making sure they're safe members of society, but oftentimes they relapse. And like Crystal was mentioning, with addiction and with eating disorders and all of these unhealthy coping skills that they, protect themselves for. And so it's a bigger topic to talk about, and it's 11 o'clock, and I recognize that. And we thank you guys for, being a great large audience today. Crystal's email's there, ours is as well. students, Rebecca and Dalina, you guys did a great job. Thank you so much. Dr. Laura, thank you.
Thank you.
We hope you enjoy the rest of your